So welcome everyone to the third webinar in the TPP Hospital webinar series showcasing the modern EPR. Now the aim of this series is to showcase how TPP is supporting the frontline digitisation requirements for NHS trusts through the SystmOne Hospital EPR, and to show how our future-proof platform has been designed to meet the changing demands, pressures and the priorities of care delivery in the NHS. Now, the SystmOne Hospital solution is an out-of-the-box, enterprise-wide solution, and it includes the following modules, but these can also be taken individually. So today's session is about the SystmOne Emergency Department solution, which supports safe and timely care and helps alleviate pressures on frontline services whilst achieving digital transformation ambitions. Department-wide overview screens give clinicians a real-time overview of current attendances, and SystmOne shared EPR and advanced interoperability allow staff to immediately see a patient's critical details, facilitating effective triage, consultation and safeguarding when it matters most. Now, we've not got a lot of time today, so if you do want to see anything in more detail or are interested in any of the other modules, we will be hosting more sessions. So the dates that are listed on the screen are the ones that are booked in so far, but there will be more to come, and links to these can all be found on our website. I'm now going to pass you over to our product specialist, Annie.
Thank you. We're going to take a look at our emergency department pathway. Firstly, we'll be looking at an attendance. Within the system, we can view the A&E overview. Here we will see all the patients which are currently attending the ED department. The screen can be broken down into different columns to view the patient's category and any specific information about that patient's attendance. Attendances can be easily recorded from here, as long as we know the patient's name and date of birth, or the patient's NHS number. At this point, the system will search the national spine and also SystmOne. This enables us to ensure that we have the accurate demographic information about our patient and also bring across the shared electronic patient record. At which point we can start to input the new attendance details. All the mandatory fields are ECDS compliant. Outside of that, we can put in further information about that patient's attendance, which will be threaded straight into our patient's record. Some of the options are configurable lists. These can be mapped to local codes and reported on. Once we have registered the new attendance, the patient will automatically appear on the A&E overview. Now let's take a look at the emergency care triage and initial assessment. I'm now logged in as a nurse and can directly access my patient A&E overview. The A&E overview screen can be configured to show us different columns dependent on our job role. We can see the specific details about our patient's attendance and also any outstanding actions which may be required. Once we filter the list down, we can see all those patients which are unassessed. From here, if our patients move location, it's a simple drag and drop action. Once this has been done, the A&E overview will be automatically updated in real time. Let's have a look at some public dashboards. Public dashboards can be configured to show current patients within a department. The dashboard which we're viewing now is a visualisation to show various different information about the attendance statistics for a specific department. These dashboards can be interrupted by call boards ensuring that our patients know which location to go to and which clinician they're seeing. An alternative dashboard is our plan view. This allows us to see an overview of the entire department and can be handy if you need to zoom in and see specific case details. We're now taking a look at the department view. This is a dashboard which allows us to see an overall view of the department and each specific patient within the department. Every patient may have individual alert indicators and also outstanding actions which can be viewed from this screen. Not only can we view specific aspects from this screen, but we can also begin to triage our patient from here. We will be using the Manchester triage. However, alternative customisable triage models can be used within the system. Our patient is presented with chest pain. So as soon as we choose our chest pain, we can start to input the vital signs. From here, we can then choose what category our patient sits within. And then we can begin to record our chief complaint, which relates to our ECDS. Any of the information which we put into our patient's admission will thread straight back into our patient record. We're currently looking at the emergency care performer visualisation. Any visualisation can be configured within the system to show the information relevant to the user. Not only can visualisations output information, but they're also flexible and can be used to input any different information throughout the patient's attendance. Let's move on to our nursing procedure. Our patient may be diabetic, at which point we will want to take some blood glucose finger pricks. This can be inputted directly into a data entry template from our emergency care performer visualisation. We can then start to use our order comms. We can choose which order set we want and which specific order we would like to make. So in this example, we've chosen to order an ECG. Once the nursing procedure is complete, we can begin our nursing handover. The emergency care performer will show all the information which has been inputted throughout our admission so far. And from here, we can begin to choose our role and then use a data entry template to input the handover information. The example which we are using is the S-bar, but other examples could be incorporated into the system. Once we are ready to hand over our patient, possibly at the end of our shift, we can then add another responsibility. Any changes to the responsibility are fully audited so they can be accessed at a later date. Once the handover is complete, we can move on to the doctor's consultation. The doctor can access the A&E overview and filter the screen via patient category. For example, we can choose to view all majors. We can directly access the patient record from here. We can then view our emergency care performer to see all the information which the nurses have previously inputted or has been inputted within the electronic patient record previously. As we have previously ordered an ECG, we can then view the results directly from here. Any abnormalities on the ECG are shown, and in this example we can see the STEMI. Following these abnormalities, we can start our acute chest pain pathway. This assessment can take place using a data entry template to capture all the structured data. Different formats can be used, such as drop-downs or even medical drawings, to ensure that we are capturing all the relevant information. Once we have completed the initial assessment, we can then move on to input our differential diagnosis. The differential diagnosis may be confirmed, refuted, or differential, depending on the patient's state. As we reach the end of the acute chest pain pathway, all the aspects which should have been carried out will prompt us at the very end. From here, of course, we could go on further to prescribe, to request the cath lab, or even request a bed if required. Let's have a look at Brigid, our clinician app. When we log on to the app, we can see our department view. All of the patients will be seen with their scheduled observations and any current scores. Directly from the overview, we can retrieve our patient record. Once we enter into the patient record, we can see the patient overview. This will show us the patient demographics, any scheduled observations. From the patient overview, we can quickly record our observations. This may be manually, or we can also pull readings directly from bedside monitors or integrations such as Mindray. We will then be presented with the outcome, at which point we can change the frequency of our next observations or even view some escalation guidance. Once this information has been saved, we can view our observations on a chart, on a grid, or even on a graph. At any point, we can zoom into our graph to make sure that we can view the specific values which have been entered. Coding and discharge. Prior to departure, we can input ECDS coding via coding templates. This ensures that we have a quick, easy and efficient method to input our codes. All we've had to do is select the cardiac set and then the specific code which goes along with it. In addition to adding the diagnosis or injury, we can also add on any information about our investigations, the treatment, or follow-up information to ensure that this is all included in the discharge letter to the GP. Once we are ready to depart our patients, we can start to fill out the discharge details. A lot of this will be populated straight from the patient's record and the current admission. But we can also add on extra details such as the expected outcome, whether they are being admitted or not, if this is confirmed, and also if they are clinically ready to proceed, which can also be entered at an earlier state by the doctors. If we have decided to admit our patient to an external place, and they are also using SystmOne, we can choose which location they are going to, and the patient will directly jump into their system. Any discharge letters can be sent to different recipients, such as the patient and also their GP. Airmid, the patient portal. As a patient, I can log into my patient app and view my full medical record. From here, I can see any discharge letters which have been sent to me. Let's have a look at some reporting. The system hosts clinical reporting, which allows you to create local reports based on any structured data which has been added into the system. From here, this allows us to link any of those reports to dashboards, visualizations, or protocols which have been created using our clinical development kit. Once we have created a clinical report, we can then break down the results to have a look at all the patients and then also display this in a graphical format. One of our hard-coded inbuilt reports is the SITREP report. This is a click and go report. The SITREP report allows us to see the number of ED attendances and unplanned follow-ups, which can be broken down by waiting times. This allows us to view the time between the arrival of the patient and their departure. Therefore, we can also see the time between the decision to admit and the individual patient departure. Within the system, we also have the National ECDS extract, which is inbuilt. This allows us to run and validate before extracting to a location of your choice. We can also set the ECDS extract to auto-run and export to a location of your choosing. Finally, let's take a look at some dashboards. The system hosts the Clinical Development Kit, which allows each organisation to create individualised tools and resources. One of the examples of this is a visualisation, which can be used as a dashboard. As we can see, our example shows all the current patients within the department. We can see the current ED status, the last 24 hours performance, and any current patients waiting with a DTA. All of these figures have been outputted from the system and link within our reporting. A further example of one of the dashboards which could be configured is the ED Opal status. So as you can see, this will show you the current ED attendances, and then this can actually be broken down by the patient category. So for example, if they are majors or minors. Each dashboard will be updated in real time. This means that they can be displayed in certain environments such as a control centre, and all the operations of the emergency department can be viewed from anywhere around the hospital without having to physically be within that specific department at the time. This brings our emergency care pathway to an end. The system has a whole host of functionality which we may not have been able to get through today. So please ensure if you have any questions you do get in touch. And we also have further webinars in the future, so hopefully we'll see you there.